The relationship between humans and dogs goes back thousands of years. Dogs have been our loyal companions, helpers, protectors, and guides. Their presence has shaped cultures, stories, and even our health. Studies show that living with a dog can lower blood pressure, ease depression, and improve survival after a heart attack. But as much as dogs enrich our lives, they can also, on rare occasions, pose health risks. With over 83 million pet dogs in the United States, it's important to understand how close contact with dogs can sometimes lead to infections. Before we dive into infectious diseases, if you're into videos like this, don't forget to subscribe to our channel. Each year, nearly 5 million Americans are bitten by dogs. While most bites are minor, about 15% of bite wounds become infected. In people who've had their spleen removed, a dog bite can lead to a serious bloodstream infection caused by a bacterium called Capnocytophaga canimorsus. This infection can be life-threatening. Most of these infections are rare and preventable. Simple hygiene and awareness go a long way. Don't disturb sleeping dogs or dogs that are eating. Wash hands after handling dogs or cleaning up after them. If you're living with HIV or have a weakened immune system, have your puppy's stool tested for parasites like Cryptosporidium before bringing them home. Because dog-related infections can range from mild skin rashes to serious illnesses, doctors should routinely ask patients about pet contact, especially when symptoms are unclear. Understanding the role of pets in a person's life can help guide diagnosis and treatment. Dog bites are a real public health issue. They make up about 0.5 to 1% of all emergency room visits, and dogs are responsible for 75 to 90% of reported animal bites. Every year, nearly 5 million Americans are bitten by dogs, and about 15% of those bites need medical care. Most bites come from dogs people know, often their own, or neighbors or friends. Children are especially at risk, with most bites happening between ages 5 and 9. Adults who work with animals, like mail carriers, vets, and animal control officers, also face higher risk. Bites tend to happen more in warmer months and usually affect the hands and arms. But in kids, about half of bites involve the face and neck. Compared to cat bites, dog bites are less likely to get infected. Still, about 3 to 18% of dog bites do lead to infection, with an average of around 5%. What germs are involved? A dog's mouth contains many types of bacteria. Some need oxygen to grow, others don't. Even if a bite doesn't look infected, testing it usually shows lots of bacteria, so doctors don't routinely take cultures unless there's a clear infection. When infection does happen, it's usually caused by a mix of several bacteria. Common ones include Pasteurella species, especially P. canis and P. multicida, Streptococcus and Staphylococcus species. Various anaerobic bacteria, those that grow without oxygen. Rarely, a dog bite can lead to a long-lasting skin infection caused by a fungus called Blastomyces dermatitis. First aid for dog bites. Clean the wound thoroughly with lots of sterile saline, saltwater solution, under pressure. Most wounds can be safely closed within 12 hours after cleaning. Deep puncture wounds should be covered with antibiotic ointment and a clean dressing and left open to heal naturally, except for facial wounds, which may be stitched to reduce scarring. Should you take antibiotics? There's no clear rule about who should get preventive antibiotics after a dog bite, but many experts recommend a short course, 3 to 5 days for bites on the hands or face, bites in areas with poor blood flow, deep puncture wounds that can't be cleaned well, people with weakened immune systems, especially those without a spleen. Treating an infected bite. There aren't many large studies on how best to treat infected dog bites. Since most infections involve multiple bacteria, treatment should cover all common types. If the infection starts more than 24 hours after the bite, doctors may use lab tests to guide treatment. If symptoms like pain or redness appear within a few hours, it's usually caused by P. multicida. Preventing dog bites. Large breeds and guard dogs are more likely to bite. To reduce risk, never leave children alone with big dogs. Teach kids not to disturb dogs that are eating, sleeping, or caring for puppies. Avoid unfamiliar dogs altogether. Dog bites hurt and they scare us. But the danger doesn't stop there. Diseases can spread through bites, contact, or even shared air. If you haven't subscribed yet, now's the time. Yes, we're moving on to zoonotic diseases. Capnocytophaga canimorsus. This bacterium lives in the mouths of about 70% of dogs and can cause severe blood infections after a bite. Since it was first discovered 40 years ago, over 125 cases have been reported. Most people who get seriously ill from this germ have underlying health issues. No spleen, 35%. Alcohol abuse, 35%. Weak immune system due to medications or illness, 17%. Symptoms include septicemia, a dangerous blood infection, shock, bleeding problems, and organ failure, meningitis, brain infection. Other issues like skin infections, joint pain, heart problems, and nerve damage. Diagnosis is tricky. This germ doesn't grow easily in standard lab tests. Newer methods like PCR and gene sequencing help identify it more accurately. People without a spleen should be warned about this infection and take antibiotics right away if bitten or exposed to dog saliva on an open wound. Heart infections, endocarditis. Some bacteria from dogs can cause endocarditis, a serious infection of the heart's inner lining. This has been linked to 1. Coxiella burnetii, Q fever. This bacterium causes Q fever, a flu-like illness that can lead to serious heart infections in rare cases. People can catch it from dogs, especially during birth or when cleaning up after them. 2. Brucella canis. This germ causes brucellosis, which can lead to fever, fatigue, and joint pain. It's more common in breeding dogs and can spread to humans through contact with dog urine, blood, or birth fluids. 3. Pasteurella multicida. A common bacterium found in dog and cat mouths. It can cause painful skin infections within hours after a bite or scratch. If untreated, it may lead to joint or bone infections. 4. Capnocytophaga canimorsus. This one lives in the mouths of most dogs and usually doesn't cause problems. But in people with weak immune systems, especially those without a spleen, it can cause life-threatening blood infections, sepsis, shock, or even meningitis. 5. Staphylococcus aureus. This is a common skin bacterium that can sometimes cause serious infections. In rare cases, it's been linked to heart infections and endocarditis after minor dog bites, even when the bite itself didn't look infected. Rabies is a viral disease that affects the brain and nervous system. It's almost always fatal once symptoms appear, but it's entirely preventable with timely medical care. In the United States, rabies is rare thanks to widespread vaccination of pets. However, in many parts of the world, especially in Asia and Africa, dogs remain the leading source of human rabies infections. How rabies spreads. Rabies is caused by a virus found in the saliva of infected animals. It spreads to humans most often through dog bites, scratches, or open wounds exposed to infected saliva. Rarely, through licking of mucous membranes, eyes, mouth. Once the virus enters the body, it travels along nerves to the brain. This process can take weeks to months, depending on the bite location and viral load. Who's most at risk? Children, especially those under 15, are at highest risk, often due to close contact with dogs and lack of awareness. People in rural areas with limited access to vaccines and medical care. Individuals who work with animals, vets, shelter workers, field researchers. Symptoms of rabies. Rabies symptoms usually appear 2 to 8 weeks after exposure. Early signs include fever, headache, fatigue, tingling or pain at the bite site. As the virus reaches the brain, symptoms worsen. Anxiety, confusion, hallucinations, difficulty swallowing, fear of water, hydrophobia, muscle spasms, paralysis, coma. Once symptoms begin, death is almost certain, usually within days. Prevention and post-exposure care. Rabies is preventable if treated before symptoms start. Key steps include 1. Immediate wound care. Wash the bite or scratch thoroughly with soap and water for at least 15 minutes. 2. Post-exposure prophylaxis, PEP. A series of rabies vaccines given over 2 weeks. In some cases, rabies immune globulin is also injected near the wound. 3. Animal observation. If the dog is healthy and vaccinated, it may be observed for 10 days. If the dog is stray or shows signs of illness, assume rabies risk and begin treatment. Rabies in dogs. Why vaccination matters. Dogs infected with rabies may show sudden aggression or fear, excessive drooling, difficulty walking or swallowing, paralysis. Vaccinating dogs is the most effective way to prevent human rabies. In countries where dog vaccination programs are strong, human rabies cases are nearly eliminated. Public health recommendations. Vaccinate all pet dogs regularly. Avoid contact with stray or unfamiliar animals. Educate children never to approach dogs that are eating, sleeping, or caring for puppies. Report bites immediately and seek medical care, even if the dog seems healthy. Bacterial zoonotic infections. Some bacteria that live in dogs can cause illness in people. These are called bacterial zoonoses, infections that jump from animals to humans. Campylobacteriosis is found worldwide and is one of the leading causes of bacterial diarrhea in humans, as common as or even more common than infections caused by Salmonella or Shigella. The bacteria live in many animals, and this large reservoir is likely the main source of human infections. People usually get infected by eating raw or undercooked poultry, coming into contact with contaminated animal feces, especially from dogs, drinking unpasteurized milk or contaminated water. Dogs as carriers. About half of all pet dogs carry Campylobacter bacteria, even if they seem healthy. Puppies are more likely to carry it than adult dogs, and dogs in kennels have higher rates than those in homes. Studies show that up to 75% of puppies under 1 year old may carry the bacteria. The most common types found in dogs are Campylobacter upsaliensis, Campylobacter jejuni. C. Jejuni can cause diarrhea in dogs, but it's also found in dogs with no symptoms. Human risk and transmission. People who live with dogs, especially puppies, are at higher risk of getting infected. Several case reports have linked human Campylobacter infections to close contact with sick puppies. In one confirmed case, a puppy passed the bacteria to an infant, causing a serious bloodstream infection, neonatal sepsis. Genetic testing showed the same strain in both the puppy and the baby. Young children are especially vulnerable because they often play closely with puppies and may accidentally ingest bacteria through hand-to-mouth contact. Symptoms in humans. Campylobacter infection usually starts suddenly with fever, stomach pain, diarrhea, often bloody. Some people feel tired and achy for a day before the diarrhea begins. Many report going to the bathroom 10 or more times a day. The stomach pain can be so intense that it's mistaken for appendicitis. Most people recover within a week. Rare complications include reactive arthritis, joint pain after infection, Guillain-Barré syndrome, a nerve condition that can cause weakness or paralysis, myocarditis, inflammation of the heart muscle. Diagnosis and testing. To confirm the infection, doctors test a stool sample using special lab techniques. In the early stages, a quick test using dark-field microscopy may help. For people with late-onset complications, blood tests serology can be useful, especially when stool tests come back negative. Treatment and recovery. The most important treatment is replacing fluids and electrolytes, especially if diarrhea is severe. Most cases get better on their own, but antibiotics may be needed if symptoms are intense or long-lasting. Salmonellosis. Some types of Salmonella bacteria, those not related to typhoid, can live in a dog's intestines without causing any symptoms. Studies show that anywhere from 1% to 36% of healthy dogs may carry these bacteria. After being exposed, dogs can continue to shed the bacteria in their stool for up to 6 weeks or longer, making it hard to know how common the infection really is. Dogs can pass Salmonella to humans through the fecal-oral route, meaning the bacteria from dog poop somehow gets into a person's mouth, often through contaminated hands or surfaces. That said, only about 1% of human Salmonella infections are linked to household pets. More recently, contaminated dry dog food and treats, especially those made from pig ears, salmon, or beef, have been linked to outbreaks in people. Humans can get infected by touching contaminated pet food, Handling infected dogs who ate that food. Symptoms in dogs. Whether or not a dog shows symptoms depends on the type of bacteria, how much they were exposed to, and their overall health. Most dogs that shed Salmonella in their stool don't look sick. When symptoms do appear, they may include fever, vomiting, diarrhea, which may be watery, slimy, or bloody. In pregnant dogs, Salmonella can cause miscarriage or stillbirth, and the bacteria may be present in the birth fluids and tissues, posing a risk to other animals and humans. Symptoms in humans. People infected with Salmonella usually experience fever, nausea and vomiting, cramping abdominal pain, diarrhea sometimes with mucus or blood. In rare cases, less than 5%, the bacteria can enter the bloodstream, a condition called bacteremia, and spread to other parts of the body, causing heart infections, endocarditis, infected blood vessels, mycotic aneurysm, bone infections, osteomyelitis. Diagnosis and treatment. Doctors confirm Salmonella by testing stool or blood samples. Treatment depends on how severe the illness is. Most healthy people recover without antibiotics. But in high-risk groups, like infants, elderly adults, people with weak immune systems, or those with medical implants, antibiotics may be needed. However, antibiotic resistance is a growing problem worldwide. Some strains of Salmonella are harder to treat, especially those resistant to penicillins, about 9% resistance, tetracyclines, about 11% resistance. Also, because Salmonella can live inside cells, lab tests may show a drug is effective even when it doesn't work well in the body. Public health considerations. Infected dogs can shed Salmonella for 20 to 40 days, and sometimes up to 100 days. If someone in the household gets Salmonella and there's no clear source, like contaminated food or travel, the family dog should be tested, even if it seems healthy. A full investigation should look for a shared source of infection between the pet and the human to prevent further spread. Leptospirosis is caused by spiral-shaped bacteria called leptospira. These bacteria move actively and can be grown in lab conditions. There are about 20 known species, but only 9 are known to cause disease in humans and animals. Different types of leptospira are linked to specific animals. Canicula, found in dogs. Agrippa typhosa, found in raccoons. Icterohemorrhagiae, found in rats. Pomona, found in pigs and cattle. Dogs as carriers. Leptospirosis is common in livestock, pets, and wild animals. Dogs play a key role in spreading the infection to humans. Studies show that 5% to 60% of dogs may carry the bacteria, especially stray dogs, male dogs, dogs older than 1 year. Some infected dogs show no symptoms, while others may experience a loss of appetite, fatigue, a vomiting, a weakness, frequent urination and thirst, belly pain, fever, yellowing of the skin or eyes, jaundice. Blood tests often show signs of kidney and liver stress, and about 10% of infected dogs may die. How dogs spread it. After infection, the bacteria can settle in the kidneys and be shed in the urine for months, or even for life. This means dogs can contaminate their surroundings without appearing sick. The bacteria survive best in moist or wet soil. Mild temperatures, above 72 degrees Fahrenheit, 22 degrees Celsius. A neutral or slightly alkaline environments. Acidic urine. Under these conditions, the bacteria can live for several weeks outside the host. How humans get infected. Humans are accidental hosts. Infection happens through direct contact with urine or tissue from infected animals. Indirect contact with contaminated water or soil. The bacteria enter the body through cuts or scrapes on the skin, mucous membranes, eyes, mouth, nose. Leptospirosis can affect people of all ages, but it's more common in young adults, men, tropical climates. Symptoms in humans. Most people have mild or no symptoms. When symptoms do appear, they usually start 7 to 12 days after exposure and follow 2 phases. Phase 1. Early infection, septicemic phase. Fever, headache, muscle aches, red eyes, a jaundice, yellow skin or eyes. protein in urine. Sometimes belly pain, diarrhea, or rash. Phase 2. Immune reaction. Meningitis, brain inflammation, recurrent fever, eye inflammation, muscle pain, breathing problems, kidney failure, continued shedding of bacteria in urine. The most severe form is called Weil's disease, which includes a liver and kidney failure, internal bleeding, shock and organ collapse. Diagnosis and testing. To confirm leptospirosis, doctors may test blood, spinal fluid, or urine for the bacteria. Use microscopy or grow cultures, which can take up to 6 weeks. Run blood tests to check for rising antibody levels. The most accurate test is the microscopic agglutination test, but it's complex and only done in specialized labs. Faster tests like IgM ELISA and PCR are often used first. Treatment and recovery. Most cases get better on their own, but if symptoms are severe, antibiotics are recommended. Common options include. All of these help reduce fever and prevent complications. They also cover other possible infections when the exact cause of illness isn't clear. During treatment, some patients may experience a Jarisch-Herxheimer reaction, a temporary worsening of symptoms due to the immune system reacting to dying bacteria. Prevention in dogs and humans. Dogs can be vaccinated against leptospirosis. These vaccines help prevent illness, but don't always stop the bacteria from being shed in urine, and protection fades quickly, so annual boosters are needed. There's no approved human vaccine in the US, though some countries use them for high-risk populations. Brucella canis is a type of bacteria that lives inside animal cells, making it harder for the immune system to detect and eliminate. It's classified as gram-negative, meaning it has a specific type of cell wall that can trigger strong immune reactions. Unlike other Brucella species, B. canis has a rough outer surface that affects how it interacts with the body. Dogs are the main host for this bacterium. It spreads mostly through mating, but can also be passed through sniffing or licking infected body fluids. Symptoms in dogs. Many infected dogs show no symptoms at all, but when illness does occur, it may include miscarriage in pregnant females, swollen testicles or inflammation in male reproductive organs, fever, swollen lymph nodes, eye inflammation, uveitis, a long-lasting presence of bacteria in the blood, bacteremia. Once infected, dogs can carry the bacteria for a long time. In some cases, the infection is so persistent that euthanasia has been recommended to prevent further spread, especially in breeding or shelter settings. Human infection. Rare but possible. Humans can get infected through contact with dog saliva or other body fluids, especially if they have cuts or broken skin. Though rare, B. canis can cause a wide range of symptoms, similar to other types of brucellosis. Common signs include fever, headache, muscle and joint pain, sweating with a strong odor. Some people develop localized infections, especially in bones and joints. Arthritis, joint inflammation. Sacroiliitis, pain in the lower back and pelvis. Spondylitis, spinal inflammation. Other possible complications. Heart infection, endocarditis. Testicular inflammation. Liver problems. Spinal abscesses. Eye inflammation. Brain and nerve involvement. Diagnosis. Doctors confirm the infection by combining exposure history, contact with dogs. Symptoms. Lab tests, blood tests, or cultures. Standard tests for other Brucella species don't detect B. canis, so specialized testing is needed. These include serum agglutination test, most common. ELISA, a type of antibody test. A PCR, a genetic test that looks for the bacteria's DNA. Blood or bone marrow cultures are positive in 50 to 70% of cases, but may take up to 6 weeks to grow in the lab. Treatment. Short treatments or using just one antibiotic often fail. The best approach is a combination of antibiotics for at least 8 weeks. Ehrlichiosis and anaplasmosis. These are tick-borne bacterial infections that can affect both dogs and humans. The bacteria are tiny and live inside cells, making them harder for the immune system to detect. Under a microscope, they form clusters that look like mulberries. Different species cause different forms of illness. Ehrlichia canis and Anaplasma phagocytophila affect white blood cells and cause monocytic ehrlichiosis. Ehrlichia chafensis and Ehrlichia ewingii affect granulocytes, another type of white blood cell. All of these bacteria can infect both dogs and humans. Ticks spread the infection, and animals like deer and rodents are common carriers. In dogs, symptoms may include eye inflammation, fatigue and loss of appetite, swollen lymph nodes and spleen, small red spots on the skin, petechiae, fever. In humans, most cases happen between April and September. Symptoms include sudden fever, headache, and fatigue. Rash may appear in some forms. Blood tests may show low white blood cell count, low platelet count, liver abnormalities. Most people have a history of tick exposure. Diagnosis is confirmed with blood tests or PCR, a genetic test. Parasitic infections. Many dogs carry intestinal parasites, and studies from autopsies show that over half of all dogs may be infected with one or more types. Some of these parasites can be passed to humans and cause illness. Cryptosporidiosis. These are infections caused by microscopic parasites that live in the intestines. They belong to a group called protozoa, which also includes Toxoplasma and Cystoisospora. These parasites are found in many animals, including dogs, cats, and farm animals. Cryptosporidium has 6 life stages, all of which happen inside one host. There are about 20 known species, but they look very similar under a microscope. The most common types that infect humans and dogs are O. Cryptosporidium hominis, mostly in humans. O. Cryptosporidium canis, mostly in dogs. O. Cryptosporidium parvum can infect humans, dogs, and farm animals. In a study of over 2,400 human cases, 56% were caused by C. parvum, 42% by C. hominis, only 0.04% by C. canis. How it spreads. People and dogs get infected by swallowing contaminated material, such as a water, tap, pool, or untreated food. Surfaces touched by feces. Sexual contact involving fecal exposure. Children ages 1 to 9 are most commonly affected, but anyone can get it. People with HIV or weakened immune systems are especially vulnerable. Dogs can carry C. parvum and are the main host for C. canis. Puppies are more likely to be infected. One study found that 80% of dogs had antibodies, meaning they'd been exposed. Globally, the rate of dogs shedding the parasite in their stool ranges from 0% to 45%. So far, direct transmission from dogs to humans hasn't been definitively proven, but some outbreaks, like among veterinary students, suggest it's possible. In 2007, a case was reported where 2 children and a dog in the same household were infected with C. canis. Symptoms in humans. Watery diarrhea. Cramping stomach pain. Fever is usually not present. In people with healthy immune systems, symptoms last 1 to 2 weeks and go away on their own. In people with HIV and low CD4 counts, it can cause severe, long-lasting diarrhea, weight loss, and even spread to other organs like the liver and gallbladder. Diagnosis and treatment. Doctors diagnose cryptosporidiosis by testing a fresh stool sample using microscopy, immunofluorescence, enzyme-based tests. Prevention tips, especially for HIV patients. The CDC and U.S. Public Health Service recommend the following. Avoid direct contact with human or animal feces. Use disposable gloves when changing diapers or cleaning up after pets. Wash hands thoroughly after handling pets, gardening, or touching soil. Avoid adopting puppies under 6 months old unless they've been tested and are healthy. If you have cryptosporidial diarrhea, don't swim in public pools for at least 2 weeks after symptoms stop. Giardiasis is caused by a microscopic parasite called Giardia lamblia, also known as Giardia intestinalis or Giardia duodenalis. It lives in the intestines and is a leading cause of waterborne diarrhea around the world. People usually get infected by swallowing the parasite through contaminated water, tap, pool, or untreated food or surfaces touched by infected stool. Close contact in places like daycares or group homes. Sexual activity involving oral-anal contact. Giardia in dogs. Giardia is fairly common in dogs, especially puppies. 35 to 50% may carry it. Kennel dogs, up to 100% in some studies. Most infected dogs don't show symptoms, but some may have diarrhea. Unlike humans, dogs don't show seasonal patterns. Human cases tend to peak in late summer. Can dogs pass Giardia to humans? The risk of direct transmission from dogs to humans is considered low, but not zero. One study found that people living with dogs were more likely to have Giardia than those without dogs. People living with infected dogs had a higher risk than those with healthy dogs. In some households, the same strain of Giardia was found in both humans and dogs. This suggests that dogs can pass Giardia to people, but we don't yet know how often it happens. Symptoms in humans. Some people have no symptoms, while others develop watery diarrhea, usually without fever, stomach cramps, bloating and gas, burping with a sulfur-like smell. Later in the illness, stools may become greasy, foul-smelling, floating. Diagnosis and testing. Giardiasis should be considered in anyone with diarrhea lasting more than 2 weeks. Signs of poor nutrient absorption. Doctors diagnose it by testing stool samples for the parasite. Because Giardia is shed off and on, multiple samples on different days may be needed. Tests include microscopy, looking under a microscope, ELISA, a lab test for parasite proteins, sampling from the small intestine in rare cases. Diarrhea is caused by parasitic worms that live in dogs and cats. The two main types are Diarrhea emitis, known as dog heartworm. Diarrhea repens, found under the skin in dogs and cats. These worms are most common in warm climates around the world. In humans, most cases happen in Mediterranean countries, but infections have also been reported in the U.S., especially along the East Coast, Gulf Coast, Great Lakes, and Mississippi River Valley. There are two main types of illness in humans. A lung infection, caused by D. emitis. Skin infection, caused by D. repens. However, both worm types have been known to cause either form of disease. How dogs get infected. In dogs, the adult worms live in the right side of the heart and the arteries leading to the lungs. They release tiny baby worms, called microfilariae, into the bloodstream. Mosquitoes pick up these baby worms when they bite an infected dog. Later, the mosquito can pass the worms to another dog, or even to a human, when it bites again. Most infected dogs don't show symptoms, but when they do, they may have skin problems, a lumps under the skin, coughing up blood, a lung clots, signs of heart failure caused by worm blockages. What happens in humans? In people, the worms can't grow into adults. Most die before reaching the heart. Sometimes, a larva reaches the heart, dies, and travels to the lungs, causing a reaction. Symptoms are rare, but when they do occur, they may resemble a lung clot. Sharp chest pain, fever, coughing up blood. Doctors may find a single round spot on a lung scan, often called a coin lesion, usually 1 to 3 centimeters wide. This is the body's reaction to the dead worm. Interestingly, the worm carries a bacteria called Wolbachia, which helps trigger the immune response in humans. Man-standing skin lumps in humans. Sometimes, the worm dies in the skin or tissue, forming a hard, red lump. These lumps are most often found on the arms, face, or around the eyes, but also in the breast, scrotum, bladder, or abdomen. Depending on where the lump is, it can look like cancer, especially in the lung, breast, or scrotum. Other infections like tuberculosis or fungal infections. Benign growths like cysts. Diagnosis and treatment. In dogs, diagnosis is made by finding baby worms in blood samples. ELISA tests are highly accurate. Treatment and prevention should be done by a veterinarian, especially in areas where the disease is common. In humans, diagnosis is usually made after removing the lump or affected tissue and finding the worm under a microscope. No further treatment is usually needed. Toxocraca canis is a type of roundworm that commonly infects puppies and adult dogs. In humans, It's the main cause of a condition called visceral larva migrans (VLM), where immature worms migrate through internal organs. How dogs get infected. Dogs become infected by swallowing worm eggs from contaminated soil or surfaces, eating infected animals, passing the infection to puppies before birth or through milk. Once inside the dog's body, the eggs hatch in the stomach. The larvae, immature worms, enter the bloodstream. They travel to the liver, lungs, heart, and other tissues. In pregnant dogs, hormonal changes can reactivate dormant larvae, which then infect the puppies. Some larvae return to the intestines and grow into adult worms, which live for about 4 months and can produce up to 200,000 eggs per day. These eggs are passed in the dog's stool but don't become infectious until they mature in the environment, usually over 2 to 3 weeks. Once mature, they can survive for months or even years in soil. How humans get infected. People, especially young children, can accidentally swallow these eggs by touching contaminated soil or surfaces, putting dirty hands or toys in their mouths, playing in areas where dogs have defecated, like sandboxes or parks. Studies show that 20 to 60% of soil samples from backyards, parks, and playgrounds contain Toxocora eggs. Children ages 1 to 6, especially those with pica, a tendency to eat non-food items, are most at risk. What happens in humans? In humans, the eggs hatch in the intestines and the larvae enter the bloodstream. They travel to various organs but do not grow into adult worms. The infection can take different forms. 1. Visceral larva migrans (VL) affects internal organs, especially the liver and lungs. Liver symptoms: belly pain, enlarged liver, and abnormal findings on CT scans. Lung symptoms: cough, wheezing, or eosinophilic pneumonia, a type of lung inflammation. Chest X-rays may show patchy areas or nodules that can move over time. Rarely, the infection can affect the heart or kidneys. 2. Ocular larva migrans. Happens when larvae enter the eye. Usually affects one eye, but can affect both. Symptoms vary and may include blurred vision, crossed eyes, strabismus, white pupil, leukocoria, eye pain or redness. Eye exams may show anything from a small lesion to severe inflammation and retinal detachment. More common in older children and teens, often without other symptoms. 3. Neurological toxocariasis. Very rare, only about 50 cases reported by 2010, can cause brain and spinal cord inflammation, encephalitis, meningitis, myelitis. May show up as seizures, and Toxocora has been linked to epilepsy. Diagnosis may involve spinal fluid tests and MRI scans. Diagnosis and testing. A confirmed diagnosis is made by finding larvae in tissue samples, but this is rarely done. Instead, doctors rely on symptoms. Blood tests including high eosinophil count, a type of white blood cell. Elevated IgA levels, a marker of allergic or parasitic response. ELISA blood test, which detects antibodies to Toxocora. About 78% sensitive and 92% specific for VLM. May show past or current infection, so results must be interpreted carefully. Stool tests are not helpful, since the worms don't mature in humans. For eye infections, diagnosis is made by an eye exam, not blood tests. Treatment and recovery. Most cases are mild and go away on their own. Rarely, severe immune reactions can affect the heart, brain, or lungs. Treatment for eye infections is often unsatisfactory, and the role of medications is still debated. Prevention tips. To reduce the risk of infection. Test and treat dogs regularly for roundworms. Keep young children away from contaminated soil. Prevent dogs from accessing play areas and sandboxes. Turn over sand in public parks regularly. Supervise children with pica and keep their hands clean. Echinococcus. This is a tiny tapeworm that lives in the intestines of dogs and wild canines like wolves. It causes a disease in humans called cystic echinococcus, the most common form of echinococcus worldwide. The tapeworm's life cycle involves dogs as the final host, where the adult worm lives. Sheep and other animals, including humans as intermediate hosts, where the larval stage forms cysts. How it spreads. Adult worms in dogs release eggs into the stool. These eggs can survive in the environment for up to a year. If a person or animal swallows the eggs, from contaminated soil, food, or water, they hatch in the intestines. The larvae travel through the bloodstream to the liver, lungs, or other organs. There, they form slow-growing cysts that can take years or even decades to cause symptoms. Dogs become infected by eating infected organs, offal, from animals like sheep. The larvae attach to the dog's intestines and grow into adult worms. Dogs usually show no symptoms, even when carrying thousands of worms. Where it's common. Human infection is most common in areas where sheep are raised. Dogs have access to sheep organs. High-risk regions include South America, Middle East, Eastern Mediterranean, Sub-Saharan Africa, China, parts of the former Soviet Union. In the U.S., cases are mostly seen in immigrants from endemic areas, Alaska residents, sheep ranchers in Utah, California, Arizona, and New Mexico. Symptoms in humans. Most people get infected in childhood and remain asymptomatic for life. When symptoms do appear, they depend on where the cyst is located, how big it gets. Cysts can stay single or develop daughter cysts, die, shrink, or calcify over time. Common cyst locations. A liver, 63 to 75% of cases. A lungs, 17 to 25%. Other organs, less than 5%. Rare sites include the brain, heart, thyroid, breast, prostate, and pancreas. Complications. Cysts can cause problems if they a rupture, leading to allergic reactions or spread of infection. Get infected. Press on nearby organs, causing pain or dysfunction. For example, a liver cyst may block bile flow or cause liver infections. A leaking cyst can trigger reactions from hives to life-threatening anaphylaxis. Diagnosis. Doctors use imaging tests like ultrasound, best for abdominal cysts, X-ray, CT scan, or MRI. Blood tests may show high eosinophil counts, a type of white blood cell, a liver abnormalities, but not always. ELISA blood test is commonly used to detect antibodies. It's 80 to 100% sensitive for liver cysts, a less accurate for lung or other organs. If tests are unclear, a biopsy or fluid aspiration may be needed, done carefully to avoid spreading the infection. Prevention. Controlling the infection in dogs is key to protecting humans. In the UK, treating dogs with praziquantel every 6 weeks reduced human cases. When dog treatment was replaced with education alone, human cases increased. A sheep vaccine has been developed and shown to be 86% effective. Other prevention tips. Avoid close contact with dogs in high-risk areas. Don't let dogs eat raw sheep organs. Wash fruits and vegetables thoroughly. Dipylidium caninum is a tapeworm commonly found in dogs. Occasionally, it can infect humans, especially young children. About 1/3 of reported cases occur in infants under 6 months old. Dogs are the main host. The adult tapeworm lives in the dog's intestines and sheds egg-filled segments, called proglottids, into the stool. These segments break apart and release eggs, which are then swallowed by fleas, the tapeworm's intermediate host. Inside the flea, the tapeworm develops into a larva. Dogs or children can become infected by accidentally swallowing an infected flea, often while playing or grooming. Once inside the intestine, the larva grows into an adult tapeworm in about 3 weeks and can live for up to a year. Symptoms in humans. Most infected people have no symptoms. When symptoms do occur, they may include stomach discomfort, diarrhea, itching around the anus. One case described an infant with colic and feeding difficulties linked to dipylidiasis. How it's diagnosed. Parents often notice small, white, seed-like segments moving in their child's stool or diaper. These segments resemble cucumber seeds and may crawl out of the anus, which can be mistaken for pinworms. A definitive diagnosis is made by identifying the characteristic egg-filled segments under a microscope. Treatment and prevention. The best way to prevent diplodiasis is to keep pets free of fleas. Treat dogs regularly for tapeworms. Maintain good hygiene around pets and children. Superficial fungal infections. Ringworm. Dermatophytosis, commonly known as ringworm, is a skin infection caused by fungi. It affects dogs, cats, and humans, and is considered superficial because it stays on the surface of the skin, hair, or nails. Some types of these fungi, called zoophilic dermatophytes, live on animals and can occasionally spread to people, causing tinea, the medical term for ringworm. These fungi don't usually invade deep into the skin. Instead, they trigger allergic reactions and inflammation, which leads to redness, itching, and scaling. Common fungi in dogs. The most frequent fungal culprits in dogs belong to three groups: Epidermophyton, Microsporum, Trichophyton. Among these, Microsporum canis is the most likely to spread from dogs to humans. Skin symptoms in dogs vary and don't point to a specific fungus. They may include hair loss, scaly patches, a redness or crusting, itching sometimes. Diagnosis. Doctors and veterinarians diagnose ringworm using medical history and physical exam. Wood's lamp, a special light that may make the fungus glow. Potassium hydroxide (KOH) test on skin scrapings. Skin biopsy. Fungal culture, growing the fungus in a lab to confirm the type. In cities, it's estimated that 10 to 30% of human ringworm cases come from animals, especially pets. Treatment and cleaning. To fully eliminate the infection, both the infected person and the pet must be treated. It's also important to clean the home thoroughly, especially areas with pet hair or skin flakes, which can carry fungal spores. Ectoparasite-Associated Illness. Dogs that spend time outdoors can carry fleas, ticks, and mites, tiny parasites that live on the skin. These parasites can transmit serious diseases to humans, including plague, Rocky Mountain spotted fever, tularemia, a Lyme disease. You don't have to go hiking or camping to be exposed. Your dog can bring these parasites right into your home. Canine scabies, sarcoptic mange. Caused by the Sarcoptes scabii mite, canine scabies is a contagious skin infestation that can spread to humans. The female mite burrows into the dog's skin, lays eggs, and the larvae hatch and mature over 10 to 21 days. Puppies and older or sick dogs are more vulnerable. Symptoms include intense itching, a red bumps and rash, crusty skin and hair loss, especially on the ears, face, legs, and belly. If untreated, the rash can spread across the dog's body. Close skin contact is usually needed for the mites to spread to humans. Up to 30 to 50% of people who live with an infected dog may develop symptoms. In humans, the rash often appears on arms, legs, abdomen, chest. Unlike human scabies, there are no burrows and no involvement of hands or genitals. The rash may include red bumps, blisters, itchy welts, crusts, and scratch marks. Symptoms usually go away on their own once the dog is treated. Diagnosis is based on exposure history, skin exam, response to treatment. Skin scrapings often fail to show mites in humans, but may be positive in dogs. Treatment for dogs includes weekly medicated baths like lindane or lime sulfur until 2 weeks after symptoms clear. All dogs in the household should be treated. Wash bedding and pet items in hot water and detergent. Chlamydosis, walking dandruff. Caused by Chlamydia mites, this condition affects dogs and cats. The mites live on the skin surface and cause flaky, itchy skin. They move quickly and sometimes pierce the skin to feed on fluids. Their life cycle lasts 21 days, and they die within 10 days off the host. Symptoms in dogs include flaky skin on the back, crusting, hair loss, itching. Puppies are more likely to show symptoms, but adult dogs can carry the mites without obvious signs. In rare cases, humans can develop a rash from these mites. It starts as red spots, then turns into bumps, blisters, or pimples. Older spots may develop a dark center. Itching can be intense and affect any part of the body, except usually not the face. Diagnosis in pets is made by Skin scrapings. Tape tests. Response to treatment. Human skin tests are rarely positive. Treatment includes topical flea treatments for pets, environmental flea sprays for the home. Human symptoms usually go away within 3 weeks without treatment, since the mites can't survive long on humans. Fleas. Fleas can cause no symptoms at all, or severe allergic skin reactions in both dogs and humans. In the US, the most common flea types are tennocephalides, Pulex. Flea bites in humans are usually minor, but they can transmit diseases like Bartonella henselae, linked to cat scratch disease. The allergic reaction is caused by proteins in flea saliva. Typical symptoms include itchy red bumps, usually on arms and legs. To confirm flea exposure, doctors may ask patients to walk through suspected areas wearing white socks, which make fleas easier to spot. Treatment includes flea control for pets and their environment, anti-inflammatory creams or medications for severe reactions, flea bombs or sprays to kill larvae and prevent reinfestation. Pets should be kept away from areas where plague bacteria, Yersinia pestis, may be present. This video is based on research conducted by Cornell University and the Cornell College of Veterinary Medicine. I'd also like to personally thank the team, especially Dr. Laura Goodman and Dr. Michael Stanhope, for their inspiring work on the potential transmission of E. coli and coronaviruses from dogs to humans. As a pet owner, I deeply appreciate their commitment to keeping both animals and people safe.